Well, the school year is also just around the corner for Hays CISD. And as cases and hospitalizations spike all across the Lone Star State, many are wondering what protections are in place for their families in the classroom. So joining us now this morning to speak more about the district's upcoming school year, we have Superintendent Dr. Wright for Hays CISD. Dr. Wright, thank you so much for taking time out to talk with us this morning.
My pleasure. Glad to be with you this morning.
Well, the first day of school is on the 19th, right? It's just over a week away. And obviously the biggest concern for most parents is the lack of a mask requirement. We're starting to see some districts defy the state's orders and make it a requirement. And one viewer wants to know, will you be joining in with other ISDs and requiring them anyway for the sake of your students? Why or why not?
So we are going to highly encourage and urge our students and our staff and our community to wear masks. We are not at this point going to recommend defying the governor's order because it is the law. And I think it would be really disingenuous to say that we were going to have a mask mandate and then not be able to have the power to enforce it because it is the law. And if I say that we're going to mandate it, then people would expect that everybody inside our building would be wearing a mask. And say I have a group of third graders that choose not to wear their mask that day, and who am I going to call? Law enforcement? And then they're going to come out and say the governor created this law and you are the one that are asking me to break the law. So no, I just don't think that would be wise because we do not have the ability to enforce that. And I understand why other people are doing it. They're trying to get the governor to take notice and to change the law. But I think there are other ways to do that. And I think we would have a trickle-down effect if we just told people that if you don't like this law or this rule, then you don't have to follow it. I think that leads to anarchy.
All right. And a viewer wrote in asking about your virtual learning options. They said, why isn't Hays CISD offering a real virtual learning option this year, like so many of the other school districts are? The only option offered in Hays is the Homebound Academy, which requires a medical note from a doctor, which can cost parents, some money for the appointment. Also, if they're uninsured, that can also create some hardships. And has the student doing asynchronous work with only access to a teacher if they have an urgent question. So how is this an equivalent alternative to the virtual learning offered last year? Could you utilize the emergency funds perhaps received from the government to fund a real virtual learning program? That came from one of the parents. What would you want to say to that parent?
I would say that our Homebound Academy is our real virtual option, and we are using our ESSER funds to help stand that up, and it will be as little as 1 hour a day based on the child's underlying medical condition, and it could be up to 4 hours of synchronous learning today according to what is best for that child and the rationale for why they're there. We wanted to go this route because other districts we found have had to limit their seats, and by going through this methodology we do not have to limit our seats. So if we do have a medically fragile child or a child that doesn't need to be in school in person, then this is what we feel is the better option. We really want to have all of our students back in person because we feel like that is the best way for them to learn as far as mental health and social emotional learning, and just the quality of instruction we feel is much superior in person.
And since most students will come back to campus, what other measures besides masks will be in place to keep COVID-19 at bay in the classroom?
So we are going to try and follow all of the CDC guidelines that we followed last year at the same time. And I know I have people on both sides, some that don't want to wear masks, some that don't have any restrictions, and others that want to basically go back to the way it was last year. But we've progressed a lot because the majority of our staff has been vaccinated. And so we're going to do the same things we did. We're going to try to spatial distance where we can and follow the American Academy of Pediatrics guidelines. We're going to still utilize the hand sanitizing. We're going to have our custodial staff and our transportation staff fumigate frequently, and we're going to make sure that we follow all those protocols. We will have water bottle filling stations instead of using the water fountains, and we'll try to spread kids out as much as possible.
And Dr. Wright, if there is a COVID-19 case, let's hope not, but if there is, what is the district strategy for mitigating the spread? We know that the Texas Education Agency says districts didn't have to notify parents or conduct contact tracing, but do you plan to still notify the parents, and do you plan to do it anyway?
Yes, we do. TEA is not following CDC guidelines in that instance because I think they're kind of tied to the governor's order, and so they kind of had to back off of that. But we are going to follow CDC guidelines and state health guidelines, and we're going to do contact tracing. We're going to let parents know when their kids have been exposed to a COVID positive. We're going to continue to keep our dashboard and keep counts so that we can be transparent, and also so that we can make good decisions, because as we move through this, if our cases lessen and the numbers decrease, then the restrictions also can be decreased as well.
And to close, we wanted to share this comment from a viewer in your district. She said, quote, "You are in a position that is impossible to please everyone. Thank you for showing up every day and for continuing to do the work that you do. We are grateful for the way you have navigated our community through this ever-changing pandemic." So some support there. I think, you can't even imagine, I can't even imagine the stress that you must have right now to make sure that all of the students in your district are safe. So thank you for your time.
Thank you so much.